I'm now joined by ADA's President of Healthcare and Education, Dr. Cynthia Muñoz. Thank you so much for being here with us.
Thank you so much for having me.
The health of the nation has been front and center this year. How have you and the ADA been pushing for better health equity, and how has the last year really informed this drive?
Thank you for this important question. The American Diabetes Association continues to create programming, create partnerships, and to tackle health inequities for people with diabetes. This year alone, the American Diabetes Association launched the Health Equity Now platform. This platform serves in part to overcome socioeconomic barriers, and it strives to increase access to research opportunities, devices, medications, so much that is needed for people with diabetes to have optimal care and quality of life. The American Diabetes Association also continues to form partnerships in an effort to create a wider network of supports for all people. Lastly, the American Diabetes Association continues to advocate for the expansion of Medicaid, for mental health access, for equity in access to diabetes technology, and so much more.
We've also seen the mental health of the population hit hard with isolation and the imminent threat of disease having a big effect, especially on those with existing health conditions. So how is the ADA working on the mental health of those living with diabetes today?
The American Diabetes Association is focused and aware of the needs for people with diabetes and their mental health well-being. The standards of care includes information for healthcare professionals to guide and support the mental health care for people with diabetes. In addition, the American Diabetes Association has a mental health diabetes education program that is designed to increase the capacity of mental health providers who are equipped to work with people with diabetes. The American Diabetes Association also has a searchable online mental health provider directory. This allows mental health professionals and people with diabetes to find mental health providers that can understand their unique needs as a person with diabetes and to provide that important mental health support.
You've shown in your own research the importance of behavioral issues related especially to pediatric diabetes. How do you hope to empower future generations living with diabetes to live healthy, happy lives?
We have a pipeline in diabetes. Not only do we have a pipeline for children who are at higher risk for diabetes because of their family history, but we also have children who experience challenges in managing their diabetes and who experience mental health challenges that negatively impact their ability to optimally manage their diabetes. Through these programs, we hope to create a positive change in the lives of these children so they can begin using more positive, adaptive, effective skills that will help them better manage their diabetes and avoid negative outcomes, including short and long-term complications. There are many things we can do to prepare young people to better care for their health and their mental health. And there are also things that we can do to better prepare parents and guardians to support the young people in their self-care while also engaging in their own care, which in turn has positive effects on their children.
Later in the show, we'll hear from Dr. Denise Karen Prochownik. What made her a great choice for this year's Outstanding Educator in Diabetes Award?
Dr. Karen Prochownik is a pediatric diabetes clinical nurse specialist, a nurse practitioner, and a behavioral scientist. She is well regarded by her peers and by the American Diabetes Association. She has received 3 ADA Clinical Research Awards. She has had NIH R01 funding, and she has provided adolescents with type 1 and type 2 diabetes with preconception counseling that has otherwise not been widely accessible for this patient population. And more than that, She has adapted her work to meet the needs for communities that have not historically had these resources available.
Thank you so much, and all the best for the meeting this year.
Thank you so much. I hope that you enjoy the ADA scientific sessions, and please join us again next year.